petting puppies and kittens and defleeing animals. And I honestly can't tell you anything about flea medications. I don't deflea animals. I don't do anything like that. So we're going to talk about what a real veterinarian does, and then the other career I want to talk to you about is that of a licensed veterinary technician. Those are like nurses in the hospital, and they do a lot of the work for me at the clinic so that I can keep seeing patients and stuff. Feel free to ask any questions along the way. One of the things that Kate said that you guys wanted to know a little bit about was the educational requirements to be a veterinarian. It is a several-step process. First thing is you need 2 to 4 years of undergrad, which means going to like Delta or Saginaw Valley before you start the application process. These are the pre-vet school course requirements that you need to take to be eligible to go ahead and apply for veterinary school. And if you have a good science background, it's pretty easy to do. Just basic algebra or pre-calc or calc, physics, regular chemistry, organic chemistry, both first and second semesters of it. You need a semester of biochemistry. You need intro to biology 1 and 2 with a lab, and I think that's probably pretty generic in terms of where you have that done. A class in genetics, and then you need an upper level biology such as cell biology, physiology, neurobiology, immunology, or histology, microbiology, well, with lab. And then the last thing is animal nutrition, which you can take a regular nutrition class instead. And then you just need basic things, like arts and humanities, a couple courses in that, social science, and then English, just to kind of prove that you're not a psycho and you're kind of a well-rounded person. What I did was I took this off the website. The class of 2017 is the next class that will start in the fall, just so that you have some idea as far as what the requirements are. The total class size is 113. The majority of them are going to be Michigan residents. Your average grade point average is, or the mean grade point average is 3.56. They also calculate a science grade point average in there, and that's 3.54. The typical age for a person starting out in veterinary school or applying here was 23 and a half, although people from 19 to 47 went ahead and did it. The majority of these people by far all had bachelor's degrees, and there were only 7 that had less than 4 years of college. The other interesting thing in the way the profession has gone in the past 20 years is that it's pretty much mostly women that are going into this. And so it's 30 men and 83 women, the fraction is. After you apply to veterinary school and get in, hopefully, there's 4 years of college beyond that, or the veterinary school itself is 4 years. And what you do is you're in class every day from 8 till 5, Monday through Friday. There are currently 28 accredited veterinary colleges in the United States and 11 in other countries around the world. Those are accredited colleges. So there are veterinary colleges that I learned this week in like Pakistan, but they aren't accredited here in the United States. Michigan State is, however, the only one in Michigan. Closer to us outside of Michigan State is going to be like Ohio State, Illinois, Purdue, Indiana. After you graduate from veterinary school, you have to we can do a 1-year internship. And this is a slide from Emergency Vet Interns, which was a TV show that was on a few years ago. Basically, what your 1-year internship after veterinary school is you work in different departments and rotate through. So you'll spend, like a month in surgery, and then a month in cardiology, a month in dermatology, and a whole bunch of time in emergency medicine, so that you learn all the different things and you get a chance to practice without you being the only one there. After that, you can do a residency, where for 2 to 4 years. This is a slide from AMC in New York City, which is a world famous veterinary clinic, and the residents there, they have them in all the different fields. And I'm going to talk just about small animal medicine because I don't really know anything about large animal medicine. So what you can see here is they're getting a blood pressure on that dog, and they've got him on some oxygen, and then you can see that they're also working on a patient behind them at the other tower that's back there. Like I said, the other career I want to talk about are the people that help me. The licensed veterinary technicians are like nurses in a hospital. They have the same amount of training as nurses in a hospital do, and they have a lot of the same requirements for that. There are programs that last 2 years. There are programs that last 4 years. Different colleges in Michigan that have this particular program are pretty much all of the Baker schools, Michigan State, Macomb Community College, and then Wayne State has a community college that also has one. This picture is of a dog that's getting allergy tested, so they've gone ahead and clipped an area on the side of his body. The purple dots are where they're going to inject the different allergens. And this is just like if you've been tested for allergies, they go ahead and they inject the different things that you can be allergic to, and dogs are allergic to the same things as humans, grass, mold, pollen. They can be allergic to cats. And so this is a dog being skin tested. I wrote some of the different specialties that are available in emergency medicine. My favorite's right in the middle there, emergency medicine and critical care. There are anesthesia veterinarians. There are veterinarians that do nothing other than cardiology. We talked about the derm ones. You can be a specialist in general practice, which is probably, you're not even going to see those around here. Internal medicine is when they go ahead and treat conditions like diabetes or hypothyroidism. Neurology, oncology is for cancer specialists, and then surgeons. We're going to talk about emergency medicine because that's the exciting one. So what I thought would be interesting would be to see the kinds of things that I really do rather than what people see in regular day practice. And so on the left side there is me examining a dog that had a foreign body across the roof of his mouth. The little dog had chewed on a bone, and that bone had gone ahead and lodged across the maxilla and was stuck in there. And so we're trying to get a good look at it there. And then what we'll do is go ahead and pull it out. But that's a real common thing that we see. On the right side, Dr. Spencer's holding a couple of dachshunds. We see those all the time because they tend to injure their discs. And so when they have a slipped disc, or in humans, a lot of times we call it a bad back, they become paralyzed, starting with the rear legs. And these guys end up needing to go see a neurologist and have surgery done to remove the disc material that's extruded up and is pressing on their spinal cord. Okay, a little interaction here. These are a couple of slides from patients that we saw. Typically when you take x-rays, you take two views. You take them laying on their side, and then you take them laying on their back. But what we did was we just showed one of each, but they've each eaten something different. So can anybody tell what the dog on the left has eaten? Overwhelming answers. Okay, so let me give you a little anatomy. The dog is laying sideways here. The head's towards the left, the tail's towards the right. Anything black is gas. So this is going to be the belly right here. That's the back of the lung. This is the liver. This is the stomach, and this is the foreign body. You can see the spleen here. There's stool in the colon, a little bit of gas in the colon. Here's the small intestines. And that's about all you can see. So this is our foreign body. On this side, this is a bigger dog.
I know what it is. It's a battery.
No? Good guess. Good guess. I'm gonna come back to that in a second, because I have a slide with the actual dog. Laying on their back, heads on top, tails down here. The bottom is of the heart, the lungs. Here's the liver. Here's the stomach and the foreign body. Stool and the colon, intestines. Any guess on that one? What would you think? Yeah. Well, maybe not a necklace per se, but what would a dog be more likely to be? Dog. Okay. This is the first one. This is Rudy. He's a dachshund. And what he did was eat a pop-up timer out of the turkey. So it actually was in him for a week or so, and it wasn't going anywhere. And then his clinic sent him over to us. And what we were able to do was go ahead and scope him. So this is a picture of the endoscope, the camera view that we get right here. This is a look at the esophagus. I don't think that's actually Rudy's though, but what we were able to do was send the camera in there with some grabbers and then align this so that it's parallel to the esophagus, and then go ahead and bring it on out. And Rudy didn't end up having to have surgery. That other one was a dog collar, a studded dog collar. And yeah, they're much more likely to be that than your bracelet, fortunately. This is a St. Bernard that we, oh no, this is her. Anyway, she ended up needing surgery. And so if you can kind of see what's going on here, this is me doing surgery. And this is normal looking intestine down here. This is where her collar has gone ahead and poked on through. And you can see the difference in color between the damaged tissue, which is all dead and is going to be removed, and the normal intestine. So what we had to do with this dog is we had to go ahead and find where the damaged tissue stopped, and then go ahead and cut it off, and then find it on the other side, and cut it off, and then suture those two areas back together again. Afterwards, there's a lot of intensive care that goes on. These guys are in the hospital for a few days until we can get them to eat again and keep the food down. They are on pain medications. This dog was on a morphine or a fentanyl drip, which means that they're getting narcotics nonstop for a good couple of days to kind of